Well, we all know a heart attack is an emergency, but what about a stroke? It too is an emergency. It's a brain attack, cutting off vital blood flow and oxygen to the brain, and it affects over 700,000 people every year. That's one person every 40 seconds. Well, joining us are some experts in handling emergencies. John Reed from Birmingham Regional EMS and Brent Deerking with North Star EMS. John, I want to start with you. Okay. When we talk about a stroke, some people don't realize just how crucial that is. It is a brain attack.
Yes, ma'am. It is an emergency, and a lot of people don't understand that they do need to be calling 911 when these things occur.
And give us an idea, what are some of the things that let you know you're having a stroke? Because that's one of the problems. We're not quite sure what's going on.
Okay, we use the acronym FAST, F-A-S-T. We're wanting people to look at the face. Is their facial drooping? Does one side of the face drop off? Look at the arms, have them hold their arms out if one of the arms tends to drift.
Okay.
Their speech, ask them to repeat a simple sentence. You can't teach an old dog new tricks. Is this sentence slurred? Is it strained? If you see any of these signs, call 911 immediately.
Now, will the person that it's happening to, will they have some sense of it, that something's wrong?
It's very possible. They may or may not be able to talk, depending on where the stroke is affecting in the brain.
Okay. So if you're with someone, look for these key things.
That's
right?
correct.
Right. And you were saying the most important thing is make that call, right?
Well, it really is. And, you know, as John was saying, when someone is showing those signs under the FAST acronym, it's scary.
Yeah.
And it's going to scare the family member. So, you know, our motto really is dial 911 because we'd rather be called and not needed than to be needed and not called. And just to also add, the BREMS region has done a remarkable job over the last several years with their stroke program for the counties that comprise this region, and has actually won some awards for that. So we really have a great EMS system that's been trained to handle these types of emergencies, so don't hesitate.
To get there quickly, and I believe I've read somewhere to get treatment within an hour can make a huge difference in your recovery from that. So don't think this is something that's just going to go away. Go ahead and make the call.
Absolutely.
Right? All right. Gentlemen, thanks for being with us.
Thank you.
Sure appreciate it.
Thank you.
And we'll be back with more in just a moment.